The year is 2050, and the world looks remarkably different than it did in 2020. Rapid advancements in technology and medicine have led to innovations in how global health crises like pandemics are managed. In the early 2020s, the world was still reeling from the impacts of COVID-19, but that devastating pandemic taught important lessons about how to be better prepared for the next outbreak. Governments and health organizations realized that early warning systems were crucial for rapid detection and mitigation of emerging infectious diseases. By 2030, most countries had implemented comprehensive infectious disease surveillance networks. Cutting-edge AI algorithms analyze real-time data from medical facilities, search trends, and social media to identify anomalies that could signal an outbreak. High-speed genetic sequencing enables quick identification of novel pathogens. Institutions share information in real time on secure global platforms. With these early warning systems, potential pandemics can be detected within days or weeks instead of months after the initial spillover event. In addition to surveillance, significant investments have been made to stockpile critical medical countermeasures like vaccines, therapeutics, and personal protective equipment. Regional reserves can be mobilized quickly to any hotspot and allocated efficiently using predictive models. Advanced manufacturing techniques like 3D printing enable on-demand production of supplies. When a new outbreak is detected, targeted non-pharmaceutical interventions go into effect quickly to reduce spread until treatments or vaccines become available. Individuals are notified of their potential exposures via health apps. Location histories and contact tracing data allow high-risk contacts to be identified and quarantined. Those confirmed ill or exposed are monitored via biometrics from wearable devices. But restrictive lockdowns are rare, thanks to precautions like improved ventilation standards, widespread point-of-care testing, and UV disinfection robots. Vaccine development has also transformed with adaptable vaccine platforms that can be tailored to new pathogens in weeks, rather than months or years. RNA, DNA, and viral vector vaccines can have a prototype designed as soon as the genetic sequence of the pathogen is available. From there, accelerated human trials helped by pre-screening populations for relevant immune biomarkers can have a vaccine ready for distribution in 1 to 2 months. New innovations like microneedle patches allow vaccines to be self-administered easily. Portable rapid diagnostics are available widely, even in remote areas, thanks to advances like CRISPR and synthetic biology. A few drops of sample on a paper strip can confirm infection with high accuracy. At-home sample collection kits enable convenient testing and digital results. Diagnostics are linked with health apps to streamline reporting. Treatments have also improved dramatically. Broad-spectrum antiviral drugs can inhibit multiplication of viruses, while more targeted monoclonal antibodies are tailored to pathogens of interest. With online computational modeling and simulation, thousands of drug and antibody candidates can be screened rapidly. Those showing promise are manufactured using efficient bioprocesses. Predictive biomarkers help match treatments to patients. Accessibility has increased through innovation of shelf-stable pills and reformulating intravenous infusions into easily administered liquids. The healthcare system is also now far more resilient to surges of patients. Hospitals use modular components to add ICU beds, and conversion of other facilities allows capacity to increase rapidly. Telemedicine and home-based care allow more patients to be managed remotely. Algorithms optimize patient routing and resource allocation in real time. Responsive staffing models tap online training programs to upskill workers and reactivate retired professionals as needed. But arguably, the most crucial change has been greater empowerment of local communities. Much better funding for public health allows robust systems at the regional and local levels for surveillance, testing, medical care, and community engagement. Governments have contingency plans developed transparently with stakeholders. Strategic reserves of supplies are dispersed across jurisdictions. Regular simulations and drills, integrated into culture and media, help normalize behavior change when needed. Risk communication is built on partnerships with trust. The economic and social policy response to pandemics has also been transformed by ideas of a universal basic income, increased paid leave, and access to technology. Governments enacted permanent programs to reduce the vulnerability of disadvantaged populations and address structural inequalities amplified by public health crises. Mental health is now integrated with pandemic preparedness, recognizing the significant psychosocial impacts. At the global level, coordination has improved immensely. Binding agreements provide incentives for transparency and enable rapid deployment of personnel and resources across borders. International organizations serve as credible conveners of information and best practices. Vaccines and treatments are distributed equitably worldwide. Regional networks allow collective preparation tailored to local conditions and cultures. Real-time maps track outbreaks across interconnected systems. The world now understands how protecting the most vulnerable everywhere helps protect all. Of course, even in 2050, infectious disease remains an existential threat. Dangerous pathogens will continue to emerge and inevitably cause pandemics. But with the investments and innovations made over the past decades, the world is far better positioned to detect, respond, and care for people during global health crises. Pandemics will not disappear, but with foresight, preparation, and solidarity, their worst impacts can be mitigated. The COVID-19 tragedy catalyzed a generational reimagining of how we manage the risk of infectious disease. While we must remain humble in the face of nature's uncertainties, the progress made gives hope that with continued vigilance and collective action, we can enter a new era where pandemics are no longer existential catastrophes, but manageable challenges that bring out the best of our shared humanity. Subscribe.